Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the important diseases, that is rheumatoid arthritis. The main problem with this disease is it occurs between the ages of 35 and 50. This is the age where you want to achieve something, how to take care of your family. There are a lot of dependencies on you at this age, and the disease affects you right at this age and hampers your ability to perform your duties or the achievements which you want to achieve in your life. The thing is, it affects more women than compared to men. If three women are affected, only one man is affected. It is 3:1 ratio. So the woman who wants to be independent, who wants to grow in their life, are utmost affected by this disease. You know that you or your loved ones should not be taking antibiotics, painkillers, steroids, or immunosuppressants at this age or any age. They are not good for your health. They have a lot of side effects because you think that there is no choice for you and you are dependent on these type of harmful chemicals or harmful medicines throughout the life, and you think that there is no other choice you have left for you. Because of this, you are in depression, you are low spirited, you think that you don't have any other choice, and you are low at your life. And also because of the roller coaster of the symptoms, sometimes symptoms may increase, sometimes symptoms may decrease, so life becomes a roller coaster. We have seen most of the men or women, because of the pains and repeated depressions or anxieties caused by this disease, we have seen lot of separations from the loved ones or the divorces we have seen in plenty of the cases. But the good thing is we have very good treatment in homeopathy. There is no need for you to use any antibiotic, steroid, or any painkiller. Because of this disease, homeopathy can handle this disease very well without any side effects. We will further look into this disease. Coming to the statistics, 1% of the population will have this disease, and if you have the relatives or the siblings or first degree relatives who have this disease, your chance of getting this disease will be increased by 5%. This is an autoimmune disorder. What I mean by autoimmune disorder is, normally when a bacteria or a virus or any foreign protein enters into your body, your immune system has to launch an attack against that foreign body. But in this case, what happens is your immune system identifies your own cells as foreign bodies and launches a attack. That is known as autoimmune disorder. This is a complex autoimmune disorder where your autoimmune systems like cell mediated immunity or antibody mediated immunity or complementary system all are activated at a time in your body, so that there is lot of damage caused to your body because of this disease. Basically, this is an autoimmune disorder where your body thinks other parts of your body as foreign bodies and it attacks them. Coming to the signs and symptoms of rheumatoid arthritis, it is very important for you to know these signs and symptoms so that you can recognize this disease as rheumatoid arthritis and you can appreciate when it is exaggerated in the course of time. First manifestation will be in your joints. Your joints will be affected. The affection will be symmetrical. Symmetrical means you get both sides of the joints. If you get pain in left hand, you also get pain in right hand. If you get the pain in the joints of right hand or leg or right side of the body, you will get on left side of the body as well. Always the affected joints are on both sides and are symmetrical. Not only one joint is affected, multiple joints are affected. Initially small joints are affected, but in the later stage where the disease progresses, multiple joints are affected. Bigger joints also affected in the advanced stages. You will have redness in the joints, swelling in the joints, pain in the joints, you have stiffness in the joints. The characteristic feature is you have nodules. Nodule means small raised portions like foreign bodies are deposited in your joints. You can see this in all the joints or almost all the joints. These are known as nodules. These are a characteristic symptom of rheumatoid arthritis. The first joints that are going to be affected are the finger joints. You will get this initially in the fingers. Coming to the hand joints, the joints of the hand. First, these are affected in your metacarpophalangeal joints. Metacarpophalangeal joints means normally we call them as knuckles. The second joints that are affected are proximal interphalangeal joints. Proximal interphalangeal joints are these joints that get affected in the second place. Then the joint affected is the wrist. Wrist is one of the commonly affected joint because of rheumatoid arthritis. It is the third joint that is going to be affected. And there is a specific type of deformities you can see in this disease. First one is swan neck deformity. Swan neck deformity is where the first interphalangeal joint or distal interphalangeal joint is flexed like this, and the proximal interphalangeal joint is extended. The joint will be like this. The next deformity we see in the fingers are botanier deformity, where it is exactly opposite, where the distal interphalangeal joint is extended and the proximal interphalangeal joint is flexed like this. So you can see this in the picture. There will be ulnar deviation of the thumb. Thumb will be deviated to the ulnar side. There will be radial deviation of metacarpophalangeal joints. These joints will be deviated to the radial side of the hand or outside of the hand like this. The next one is carpal tunnel syndrome, where it will affect the wrist because of the affection in the wrist, because of the nerves that are pressed at the wrist. You have the pain in the hand, numbness in the hand, tenderness in the hand, lot of sensations or tingling and numbness in the hand you can see because of this carpal tunnel syndrome. And coming to the feet, you can see the joints of the feet are also affected. They can be a cloto deformity, or they can be a hammer toe deformity, or they can be subluxation of metatarsals, where the toes of the feet goes under the previous bone. So it will be like bone under the bone. You can see that deformity in advanced cases as well. The other joints that are going to be affected are the shoulder joints, the knee joints, or the hip joints, or the ankle joints, and also especially the cervical joints, where C1 and C2 joints can be affected because of this disease in the later stages. Not only the joints, there are other systemic affections where it affects whole of your body. Like you can have fever, you can have body pains, you can have malaise means you will feel like you have fever but you will not have fever. You will have total body pains. There can be severe weight loss, they can be sweating at night, they can be sleep disturbances as well because of this disease. These are all the common systemic problems you have with this disease. And coming to the affections of other parts other than the joints, there are a lot of parts that can be affected. Coming to the skin symptoms, they can be nodule deposition, especially on the elbows, on the wrist, on the hands, on the toes. Lot of places you can see the nodules. There can be purplish discoloration. There can be micro bleeding on the skin, and also there can be ulceration of the skin. There can be ulcers formed on the skin at various places. And coming to the affections of the eye, there can be redness of eyes, swelling of the eyes, there can be edema of the eyes, and also they can be dried eyes. The eyes can get dried. It can also affect liver. These inflammatory mediators can affect liver. When it affect liver, what happens is your C-reactive protein is raised. You will have severe anemia, lot of indigestion problems, and also pain in the liver you can see sometimes. One of the major organ it affects in the advanced cases is your heart. There can be lot of heart symptoms like palpitations, and also severe symptoms like there can be block formation, there can be deposition of cholesterol in your heart. You can have heart attacks, you can have damage to the myocarditis, means heart muscle can get damaged because of this disease. Pericarditis means there will be layers around the heart that will protect your heart. Even these layers get inflamed due to this disease. Heart is one of the major organs that get affected because of this disease in advanced cases. Coming to the gastrointestinal system, your digestive system, normally you have dry mouth. There are a lot of neurological symptoms you can see in this disease. When the nerves are affected or brain and spinal cord is affected, you will see a lot of depression, lot of anxiety, and also lot of weakness due to anemia. And coming to the bones, it affects your bones. The calcium from your bones is resorbed. It affects your bones, it weakens your bones because of osteoporosis, where the minerals deposited in your bone comes out. Your bones will become very fragile and tender and weak. Coming to the muscle, you will have weakness of muscle, loss of muscle, or loss of muscle protein. There can be soreness of the muscle, there can be tenderness of the muscle. Muscles become painful as well. It affects your bone marrow as well. Bone marrow is the main organ that produces your RBC or red blood corpuscles. Because of this, you land into anemia. Your blood values of hemoglobin comes down because of this. After heart, one of the major organs that is going to be affected is your lungs. It damages your lungs. There will be a lot of pleural effusion. Pleural effusion means collection of water or fluid in your lungs. So this is called pleural effusion. There can be scarring of the lungs. There will be lot of damage caused to the lungs. There will be lot of inflammation caused to the lungs. Because of this damage, lung tissue is replaced by scar tissue. There can be plenty of scars on your lungs. This can lead to dyspnea. Dyspnea means breathlessness. You feel short of breath, or you feel shortness of breath, and also a lot of complications and other symptoms related to the lungs can be seen in this disease, because heart and lungs are the major organs affected by this disease, that is rheumatoid arthritis. All these signs and symptoms is very important for you to remember and know if your loved ones or you are suffering from rheumatoid arthritis. In rheumatoid arthritis, you have to know about the investigations you have to do and how you have to assess those investigations if you are suffering from rheumatoid arthritis. First one is X-ray. When you take the X-ray in the initial stages, you can see lot of soft tissue swelling in your hands and legs. Next one is CBP. In complete blood picture, you can see elevated levels of ESR. Though ESR is elevated in other diseases as well, in this disease also ESR is elevated, and this is non-specific for this disease. And coming to the CRP, C-reactive protein, this is also elevated in your blood. What it means is there is lot of inflammation in your body, and this is also non-specific for, or this is also common in other diseases or other inflammatory diseases as well. You can see CRP is raised in this disease also. There are two important investigations you have to do for this disease. Is one is rheumatoid factor, and the next one is anti-CCP. Coming to rheumatoid factor, it is almost specific but not specific, but this is elevated in 70% of the patients but not all the patients. So what it means is it is also increased in other diseases as well. And coming to the next specific important investigation, that is anti-CCP. Anti-CCP means anti-cyclic citrullinated protein. This is an IgG antibody. This is an immune complex where you can identify in your blood. This is specific for this disease. This is increased in all the rheumatoid arthritis cases, and this is a specific disease you have to do for identification of this disease or confirmation of this disease. And coming to the important structures and functions you have to know in this disease is especially the working of immune system and also the joint anatomy and physiology. So you have the immune system, and this immune system has to fight against the foreign bodies that enter into your body. This immune system should not be fighting against your own tissues or the cells. This is the wrong way. So it has to attack foreign bodies or foreign organisms so that you are healthy and your immune system is healthy. The important thing you have to know is the structure of the joint. So in the joint there are two or more bones involved. Each bone will have a cartilage, and this entire joint space is closed in a capsule, and inside the capsule you have a synovial membrane where it secretes synovial fluid. This synovial fluid is viscous and it acts like a lubricant so that there will not be friction in the joint. The importance of the joint is to provide you with the movement. As a rheumatoid arthritis patient, you have to know about the causes of the disease. It is very important. Coming to the causes, mostly this is genetical. There is 5% more chance of getting this disease when your first degree relatives like your father, mother, siblings, or other blood relatives who are first degree relatives are rheumatoid arthritis positive. The main reason for this disease is unknown. There is no specific reason. Genetics is also one of the causes for this disease. There are some risk factors identified for this disease. First one is smoking and also some bacterial infections. Some bacteria can trigger this disease, and also smoking can trigger this disease. As a rheumatoid arthritis patient, you have to understand the pathology of this disease. Pathology of the disease means what exactly happened in your body when you get this rheumatoid arthritis. It is very important for you to know so that you can assess the progress of the disease, whether the treatment is going in the right direction or it is going in the wrong direction. You can assess if you know this part of the video. See, you have to understand the human body or every person's body. One of the important tissue present in everyone's body is collagen. There are two types of collagen, collagen type 1 and collagen type 2. Especially in the collagen type 2, where it provides your body with the stretchability or shock absorbance. With the advancing age, the type 2 collagen will be decreased in the body. That's the reason you get all the symptoms like wrinkles on the skin, so damage to your cartilage, joint pains. All these problems in the old age are because of this collagen. If the collagen decreases, you will see all these diseases in your body. This type of collagen, that is type 2 collagen, is very important here. There is one important amino acid in this collagen, that is arginine. Because of the risk factors, maybe due to genetics or because of smoking or because of bacteria, what happens is there will be changes in the gene. These changes in the gene are known as epigenetics. Because of this epigenetics, this arginine amino acid is replaced with citrulline amino acid. Citrulline is the wrong amino acid that should not be present in collagen type 2, but it is replaced in the collagen type 2. Because of this, the immune system present in your body identifies this new type of type 2 collagen as foreign body, and your immune system launches attack against it. Initially, it is a type of immunity, cell mediated. You do no need to know about what is cell mediated, but after that, there is other immune system, that is antibody mediated immune system. This also attacks the system. And the third type of immune system, that is complex system. This is also activated and this also attacks your body. So basically, all these types of immune systems are wrongly activated in your body. Because of this, all the symptoms are produced. You can forget about the names of the different types of immune systems. You can just remember there are multiple immune systems in a human body. All these immune systems are activated in your body wrongly, that should not be activated. You just remember this, that is fine. And coming to the individual joint, what happens in your individual joint? Every joint or two bones in a joint are covered with capsule. Inner part of the capsule is known as synovial membrane. This synovial membrane get inflamed because of lot of inflammatory mediators. They can be damaged to the cartilage, they can be damaged to the bone, they can be damaged to the synovial fluid. All these are activated, complexes are activated, immune system is activated here, and this causes damage. This causes redness, pain, swelling, edema. All the symptoms are because of activated immune system within the joint also. Once it attacks the bones, it also attacks the heart, producing lot of heart symptoms and also lungs. In heart, it can produce myocardial infarctions, heart attacks, or the layers protecting your heart get inflamed, or the muscle of your heart where there is a heartbeat, the muscle of your heart can also get inflamed because of this disease. And coming to the lungs, there can be pleural effusion. Pleural effusion means accumulation of fluid in your lungs. The lungs can get damaged because of severe inflammation in the lungs. The lung tissue is replaced with the scar tissue. There can be shortness of breath, breathlessness, and there can be lot of cough and also sputum coming out of your lungs. You have to remember the major organs that are to be affected by this disease is number one joints, number two heart, number three lungs. In rheumatoid arthritis, what treatment options you have either in allopathy or homeopathy? Allopathic treatment, also known as conventional treatment or also known as Western treatment, is also known as English medicine. This is the treatment you take from the doctor who is nearby your home, or the corporate hospital, or the specialist hospital in rheumatology. All this is known as English medicine or conventional treatment. There is no specific cure or treatment for this disease. What they give is, when you have pain, they give painkillers, they give immunosuppressants, as this is the disease related to immune system. They give immunosuppressants, especially steroids. Because of this, your immunity is decreased and you have a lot of infections. And next one, what they use is painkillers and antibiotics. Because of painkillers, there are a lot of side effects. It can damage your liver, it can damage your nerves, it can damage other parts of your body. And also, because of antibiotics, there are a lot of side effects when you use antibiotics, because of infections in the lungs or the secondary infections in the lungs or joints because of this disease. You know that antibiotics are not good, painkillers are not good, steroids are not good, immunosuppressants are not good, but still you are forced to use these drugs on your kids, your loved ones, or your elders, thinking that there is no choice and there is no cure. Now you have to endure the symptoms of the disease and also the symptoms of the drugs or the side effects of the drugs. But the good news is you have the best treatment for rheumatoid arthritis in homeopathy. There is no need of using any of these addictions or the side effects causing drugs. With homeopathy, with constitutional treatment and also the local treatment, all these symptoms can be gone, or all these symptoms can be cured. Most of the times this disease can be cured after a long time in most of the people because of this treatment. In homeopathy, the treatment is very effective, very safe, and also there are no side effects, not even one side effect. You can treat this disease very effectively compared to any other system of medicine. So homeopathy is the answer for your rheumatoid arthritis. You can see the reduction in the intensity of the symptoms, you can see the reduction in the duration of the symptoms, and also reduction in the frequency of the symptoms. Sometimes this disease can be completely prevented, or the symptoms which you already have will have reduced symptoms, and sometimes it can be completely cured. I have seen lot of cases where this disease is completely cured. I'm not saying that in every patient this disease can be cured, but most of the patients you can live a normal life with homeopathic treatment. So homeopathy is the best answer for this disease. With homeopathic treatment, the quality of the life is improved, the quantity of the life is improved. You will live longer, you will live happy life because of the homeopathic treatment. Homeopathy treatment is very important for you to take, whether you are taking allopathic treatment, whether you are in steroids. So the important question you ask is, so I'm already on steroids, can I switch to homeopathy? Yeah, you can take steroids along with homeopathy over a period of time. You have to cut down the doses of steroids. Maybe you are using 100 mg. Over a period of time, you have to use 70 mg, 50 mg, 20 mg. Finally, you have to wean off. You should not be stopping suddenly. Same thing with the painkillers. If you are using painkillers for a long time, you should not be stopping suddenly. As you take the homeopathic treatment, as the symptoms improve, it means intensity, duration, frequency of the symptoms decreases. So you have to cut down on the painkillers as well. You should not be stopping suddenly. So finally, homeopathy is the best treatment in any stage of the disease, whether it is initial stage, middle stage, or the final stage. You can take homeopathic treatment. It is very important for you to know the precautions for this disease or rheumatoid arthritis. First one is you have to be very careful when you are walking, running, or jumping, because of this disease your bones will become fragile. They are more prone to fractures. That's the reason if you or your elders are suffering from this disease, you have to be very careful while walking or doing any physical activity. Next one is because of this disease, lot of mineral is gone from the bone. That's the reason you have to take plenty of soup. That is bone soup. Bone soups are the best food for this disease. You can take plenty of bone soups where it can replenish your minerals that is to be deposited in your bone. Next one is vitamin D. You have to expose yourself to the sun so that you have plenty of vitamin D and there is no bone fractures or joint affections aggravating by this. On all costs, avoid sugars and processed food because sugars and processed foods increase the glucose in your body. This glucose causes inflammation. Because of the inflammation, there can be lot of damage to your bone and your joints. So your inflammation will increase and your pains will increase because of sugars or the carbohydrates or the cereals you are taking. So cut down on cereals, cut down on sugars, be on low carbohydrate diet. Coming to the oils, which oils to be avoided, which oils to be used. If you use seed oils, oils made from the seed, like sunflower oil, safflower oil, or any other oil, cottonseed oil, it has a lot of omega-6 fatty acids in it. These omega-6 fatty acids are highly inflammatory. This increases your pain. This increases the damage to your tissues because of rheumatoid arthritis. So you should be on the oils that are low in omega-6. The three best oils are, first one is coconut oil, second one is groundnut oil, third one is mustard oil. Avoid refined oils. Only take cold press oils, the oils I have mentioned. One more important precaution you have to take is using omega-3 fatty acids. You can go to Amazon, directly purchase fish oils. Ensure that fish oil has both EPA and DHA in it. Use it. Fish oils or omega-3 oils will reduce the inflammation. They can protect your heart, protect your lungs, protect your brain, protect your joints. They are highly protective and this decreases the inflammation in your body. This is very important supplement you have to take when you are rheumatoid arthritis positive. One more important thing is if any food or any activity is increasing your joint pains, avoid that food or activity. These are the important precautions you need to take. And also coming to other important precautions, sleep. Sleep is very important. You have to ensure that you have 7 to 9 hours of sleep per day. Both quality and quantity of sleep is important in this case. Exercise regularly when there is no pains. You have to exercise from mild to moderate exercises. There is no problem in it. And also be away from the stress. Don't stress yourself. Being out of stress is very important for the good prognosis of this disease, for good improvement in this disease. For the treatment you have to be out of stress. Next thing is if you have any habits like smoking, alcohol, marijuana, drugs, or any habits that is causing you depression or any problems, you have to come out of that addiction and you have to stay addiction free so that your quantity of life is increased and also quality of life is increased as. And coming to the prognosis, what happens if you don't treat that disease? It will be initially in the single joint, it goes to multiple joints, there will be a lot of deformity in the joints. And coming to the heart, there can be palpitations of the heart attacks, heart muscle get damaged, the covering or the protective layers around the heart get damaged, they get inflamed. Lot of heart attacks can be seen in this disease. And coming to the lungs, symptoms of lungs, there can be pericarditis where the protective layers around the lungs will get redness, swelling, pain, and also your lungs get damaged. The lung tissue is replaced by the scar tissue when there is high inflammation. You can have shortness of breath, you can have breathlessness, and you can have a lot of cough, cold, sputum, everything because of this disease. So this disease first affects joints, next affects heart, next affects lungs. Lungs and heart are the major organs of your body. If you neglect, this disease going to attack your lungs and heart. So for this, homeopathy treatment is best. At Fidicus Homeopathy, you have the best treatment for rheumatoid arthritis. We give you two types of treatment. One is online treatment and in-person treatment. Online treatment wherever you are in the world. You are in Asia, Africa, Europe, America, wherever, you can consult us through audio or video call. You can share your reports and we will ship the medicines to your place, to your home comfortably within 1 to 5 days. If it is India, it will take 2 to 3 days. If it is out of India, it will take 4 to 5 days. You can use at your comfort. We are shipping the medicine and treating the patients of rheumatoid arthritis all around the world. Or else, if you want to meet us in person, you can inquire about the nearest physical clinic. You can visit there, see our doctors, discuss with them, and take the treatment. Finally, homeopathy is the best answer for rheumatoid arthritis. Thank you.
Fidicus Homeopathy.